In veterinary medicine right now, there's a thing called, and you should be watching out for it, there's a thing called, quote, high quality veterinary medicine, end quote. And what that is veterinary medicine that's thorough and highly diagnostic. It doesn't really leave any questions unanswered. Now, the reason high quality veterinary medicine is so desirable these days and they try to purvey that to you as something you should desire because you want thorough, accurate, and highly explanatory veterinary medicine, don't you, for your precious dog? Is because it's super profitable to run a whole bunch of tests and answer a whole bunch of questions. Like, true or false, I'll say, well, we have discovered a small mass in your dog, and it does appear to be behind the eye. And we really need to know if it's benign or malignant. True or false? Because, like, that sounds absolutely logical. Like, we'd like to know the cell type involved. We need to know if it's benign or malignant. We need to know if it's pressing on any vital structures. Okay, but see, the thing is, like, that's misdirection because really your question should be why? Does that benefit the animal? Why? How does that help the dog? Because if you know that you're not going to dig that eyeball out, if you know that you're not going to put radioactive beads behind the eye, if you know you're not going to triangulate it and do radiation on it, why do you need to know anything about a disfiguring tumor or a migraine behind the eye? Once they know it's a cancer or a tumor or inoperable mass behind the eye, why does high quality veterinary medicine step in and say, we need blood work, we need a urinalysis, we need an x-ray? Why? And we need a CT and an MRI, then we need ultrasound guided biopsy with a Jamshidi needle. You don't need any of that. If that mass is staying right there, if that mass basically represents an end of treatment, why do you need more information? So to get around that, people asking the question, why? How does that benefit the animal? These guys are actually taught to give this answer. This answer. We'll know that answer to that question better after the next test. So you can ask me like literally any question in veterinary medicine about your pet as it goes down this shredder of expense. And does it really need this test? Well, we'll have a better idea about the answer to that question after this next test. Is my dog even going to live? Well, we'll have a better answer to that question after this next test. Statistically speaking, have any dogs ever survived with this blood disorder? We're going to have a better idea about the answer to that question after this next test. It's beautiful from a marketing and business standpoint. It drives spending. Absolutely awesome. You can get the answers to so many useless questions just by selling the next test, trying to answer the last question. And then when they're all done and they've run every single test and they have all this high quality medicine done, they can tell you that, well, I mean, yeah, we kind of knew. Yeah, we pretty much knew like 3 days ago that the dog was going to die because that kidney value, that creatinine was like a 7.0. But we misdirected and kind of went after this tumor thing, kind of ignoring, like we just ignored the super picture and got you tons of information about this mass and helped pay off our CT scan and MRI. And the shareholders are really, really happy with the production at this location. So I said all that to say this. The question you need to be asking is why? How does that help the animal? Why? Can I do anything with the results of that test? And just hope that you don't get the answer. Well, we'll have a pretty good answer for that question after the next test.